Now, there is always one figure in every professional that everyone reveres and everyone inspires to be. And that figure in obstetric ultrasound is Dr. B S Ramamurthy. We cannot get enough knowledge from him because he had so much to give. I had an opportunity to have a one-to-one with him where I asked him some very important fundamental questions about obstetric ultrasound practice. Let's see what Sir has to say. When we talk about cricket in India and we think about Sachin Tendulkar, we address him as God of cricket. When we talk about radiology in India, we think about ultrasound. We think about Dr. Ramamurthy sir as the God of ultrasound, obstetric ultrasound, especially in India. And today, I have the great privilege and honor of having Dr. B S Ramamurthy sir with me for a candid conversation. Thank you so much, sir, for taking out your valuable time and guiding us.
Thank you, Dr. Soni, for the description you've had of me. I don't deserve.
Sir, absolutely not, sir. This is, I mean, if there was somebody who could have deserved it, it is you. And we have all grown up learning ultrasound, obstetric ultrasound from you, and we are all very thankful. So, in fact, on behalf of the entire radiology fraternity, I'm thanking you.
Oh my goodness. Thank you so much. Thank you. I'm really humbled. Thank you.
So today I want to ask you certain very important questions because we need your guidance. I talk to so many radiologists, sir, because they call me, they need guidance. They are interested in doing a ScholarMD fetal medicine training program. Many of them are beginners who have just completed their post-graduation. Some of them are into practice 5 to 10 years, and some are into practice for almost 20-25 years. Their usual questions are how this course is going to help us. And besides the other things that we teach them, other than the core obstetric ultrasound, one thing I always emphasize on is the importance of the grayscale and Doppler diagnosis. So today, sir, I want to understand from you, how does grayscale and Doppler, it forms the foundation of fetal medicine?
You've said it already, Dr. Soni. If there is one specialty which was created in modern medicine, it is fetal medicine created out of ultrasound.
Very true.
If there is no ultrasound, there is no fetal medicine. That's how the whole the subject developed. That's how the content developed. That is how it is totally a specialty today, a specialty which can stand on its own, and a specialty which is pertinent to the entire pregnant population. So you know the scale of work that we have on hand, right? Now, the thing in ultrasound is we study structure. And the subject we are studying is a subject which is not yet evolved and formed fully. We are looking at it from its stage of embryo to a stage of fully grown fetus. And if there is a miracle on earth, the miracle is the growth of a single cell into a whole individual. And ultrasound today has enabled to track these events in a very systematic manner.
True.
Meaning that we need to understand how embryology works. And we need to understand how embryology in motion actually translates into findings that we see when we scan or do ultrasound at various stages of pregnancy. We all know that, yes, we are seeing structure. And when it comes to structure, we know that there's normal, there's abnormal at any stage, given stage of pregnancy. And again, stage to stage, there may be difference, normal versus abnormal. So the first thing that we need to know is to recognize normal, and even before that, how to produce the image.
Very true.
Unless you have an image which is intelligible,
Correct.
which is interpretable, you will not be able to say whether it's normal or abnormal. So first of all, how do we get such images, be it grayscale or be it color Doppler, spectral, whatever, as you very rightly pointed out? So first of all, how do we get those images, right? Number one. Number two, what are the standard set of images that we need to do at various stages of pregnancy according to international accepted guidelines? Number two.
Correct.
Having obtained these images and having known the skill that is needed to obtain such images, we go on to learn what is normal. So what is normal itself comes after this journey of us.
Very true.
Having done what is normal of the various systems, remember, as fetal medicine, you can't say, I am a fetal brain specialist, I am only a heart specialist. No, you have to cater to the entire fetus,
Right.
be it GU, genitourinary, gastrointestinal, CNS, CVS, muscular, whatever. So you're all rolled into one. So we need to have good images, we need to know what is normal. Having known what is normal, we are now in a position to recognize any departure from normal, right? Any departure from normal means a variation or an abnormality, means something which is grave to the fetus or something which may not be grave to the fetus at all. So this is the journey, and I think our course that we have put together today addresses every stage in what I've said. How to produce an image, how to interpret in terms of a checklist. So production of the image and number of images to be produced, or videos, or store in whatever way you desire to store. But every clip or still or section that you study is backed up by a checklist. Unless you run the checklist and call it normal or call it abnormal, as the case may be, you don't move to the next section. So therefore, there are two checklists, one of the images that we've got to store or clips that we have to store, and a checklist for each of these images. This course teaches us that.
Beautiful, sir.
That is exactly what we did. Pattern recognition, skill set to obtain those images, and how to maintain records. Everything attended to in a very systematic manner. We are going system by system, and it's 3 days per sitting with 4 sittings, 12, and started morning 8. And if the venue permits, we overshoot and go. That's the kind of ambit.
Yes.
And also the fact that fetal medicine is beyond imaging also.
Yes.
We need to be good at so much in obstetrics. We need to be good at so much in genetics.
True.
And these aspects are also very, very well represented today. So if there's a holistic approach, I think this is it.
Wonderful. So the way you have summarized it, so true. And in fact, what you have elaborated is basically, unless you have a good phenotype, you cannot think of a genotype.
Absolutely.
It's a wonderful message that you've given. Sir, one question that always comes to my mind is, maybe I'm thinking a little extravagant. If a young radiologist, he wants to become like Dr. Ramamurthy, he aspires to become, even if he comes close to what you are, it will be a life worthwhile living for him. Sir, I really want to ask you, when you started out in obstetric ultrasound practice, at that time, I don't think there were any certificate courses or structured training programs that way. Has a lack of that kind of qualification, I'm not saying training because you've trained yourself in that way, but has any lack of qualification in that area, particularly fetal medicine or anything like that, has it ever hampered your practice?
Oh, it's a good question. Since you're talking of me in particular and asked me if I felt there was a deficiency of certification, remember I'm as senior in the country as the specialty is. meaning we grew from very meager resources.
True.
Libraries, the journals, the very, very far and few textbooks. There were 2, 3. That's it. And then we had a few articles coming through. That's it. Very, very strapped for resources. But as the science grew, we grew with it. And that is why Even today, I'm relevant. I've not become a relic.
Of course.
So that's one. Number two is I wish our young radiologists to outpace me. I'm not at all a gold standard. They all should do well, and I know there's potential. I know there's potential, and a lot of people among radiologists have taken to fetal medicine thanks to ScholarMD. Thanks to the presence of this.
Thanks to Dr. Ramamurthy. I think if there is one figure that has inspired radiologists all across India to take up obstetric imaging, it is Dr. Ramamurthy, sir. And we cannot thank you enough for that.
No.
So I think this interaction and this guidance that Ramamurthy sir has given us, these are like gems that you would not find anywhere else. And I'm very thankful for you, sir, that you've shared your wisdom with us.
Can I just put another point?
Definitely, sir.
You talked of certification. After all, who certified us? There was nothing, we grew. But now the amount of literature is so much, the amount of knowledge that we have about fetus, the imaging, whether it's ultrasound, MRI, genetics, is so much that the present generation has to grapple with an excess of information, so much, and filter out what is needed, what is not needed. Now, you talked about certification. After all, what does a certificate do? It is supposed to give you the skill that you're doing a certain task to the best of the capability. Ultimately, we get patients. We get referrals.
Correct,
we don't
sir.
have primary patients.
Correct.
Who sends our patients? The obstetricians. You, whether you're certified or not, you are a radiologist. Correct. You do your work properly. When you do your work properly, that work should speak for you.
Beautiful.
Not a piece of paper.
Beautiful.
I don't think certificates may come, may go, but the quality of work, the devotion, the passion you have to the fetus matters, because fetus can't talk.
Very true.
A fetus cannot complain against a doctor. It is voiceless. You, from the depths of your heart, should say that I'm not going to take shortcuts. I will see every corner of the fetus as per guidelines, and no shortcuts. If I'm not able to get a section, I'm going to wait. Ask her to come back. I'm going to persevere until I get what I want. And if you maintain those standards of work will search you
Absolutely.
out. Work will come behind
Definitely.
you wherever you go.
So I think for everybody who is watching this is what greatness is. This is what greatness really is. He has always chased excellence in his life, and that is what makes Ramamurthy sir the great stature that he has, the wonderful teacher that he is. And therefore I feel for all the young radiologists who are watching, please chase competence, because that is what is going to take you ahead. Have passion for the subject like sir has. Develop that kind of confidence by training yourselves well, and nothing can stop you. Am I right, sir?
Absolutely. You said it all. You said it all.
Thank you so much, sir, for giving us your valuable time.
Thank you, and thank you for putting this course together. And,
My pleasure, sir.
And carrying the flag so high.
Our pleasure, sir. Thank you so much.
We've had a fantastic time rallying around what you have done.
Spending time with you has been the biggest gift for me as far as ScholarMD is concerned. Thank you so much.
Thank you.
Thank you, sir.
Thank you.